This is the Crisis Theory media presentation. We're going to look at the seven key concepts of crisis theory. The first concept is the crisis itself, followed by crisis intervention and the fight or flight responses that occur. Crisis is a personal or external event that creates a temporary state of psychological disorganization and often impairs functioning. Crisis intervention focuses on helping a client return to a previous level of functioning using a quick and short term intervention. The terms fight or flight are automatic psychological responses that affect people during crisis. Some additional key concepts include coping skills, and those are choices that individuals make in an attempt to relieve or alleviate stress. When current coping skills are not working, this can lead to chronic stress, whereas a person has high levels of anxiety for an extended period of time. And prior to the chronic stress or crisis, there's a precipitating event. Therefore, social workers have an opportunity moving forward to support clients in preventing a reoccurrence of traumatic events. Here we'll talk about the four principles of crisis theory. As mentioned, crisis intervention is time limited, therefore, both the engagement and assessment occur simultaneously and efficiently. Social workers can modify services based on the client's concrete and emotional needs and help them return to previous levels of functioning prior to the crisis or stress indicator. The goal of the crisis theory intervention is to restore a client to a pre-crisis level of functioning. It recognizes that crisis can occur at any time. Therefore, this intervention is a quick and flexible strategy to restore a client to a pre-level function. A sizable amount of research validates the use of crisis theory, which also validates one of its additional strengths. But it does, however, have some limitations. Crisis theory may not be helpful for clients who are continuously in crisis and does not resolve underlying issues or long-term psychological problems. Other limitations of crisis theory include a lack of evidence in regard to whether it's used in group or individual interventions, and it does not resolve social issues such as discrimination or prejudice. Crisis theory has great value in the practice setting, specifically in microsocial work. Normative or unusual events may trigger crisis within an individual, sometimes due to the culmination of events. And crisis theory is a natural fit and should be utilized during times such as these. The first step in the utilization of crisis theory is to develop a prevention plan with the intent to ensure proper response or to avoid the crisis altogether. And this is done by identifying triggers, stressors, and coping skills, as well as developing crisis plans. In recognizing the impact that trauma has on individuals, social workers can meet the client where they're at by focusing on the crisis event and then moving the assessment along. Social workers must utilize their soft skills in order not to escalate clients who are currently angry, loud, or volatile. Robert's seven-stage model of crisis intervention is used to create a general understanding and apply the unique experiences of the client into the conceptual framework. After conducting the assessment and establishing a relationship with the client, social workers can identify major problems and explore the client's feelings and emotions. And once this is done, the social worker and client can generate and explore alternatives and then formulate an action plan and establish a follow-up method. Because everyone experiences crisis to varying degrees, therefore, social workers must be prepared for a variety of crisis situations. Crisis theory is adaptable to different cultural populations, which allows social workers to further understand the cultural norms and values of their clients as well as their own. So let's look at some specific cultural examples for applying crisis theory in an atypical practice setting. Reaching out for help can be difficult in the Latino culture, so social workers must be aware that labeling clients as resistant to therapy is not necessarily the case. Stigma may be associated with seeking therapy. Therefore, helping clients to alleviate those fears and look to family members as resources can be a really effective tool. Due to the fact that many people of color experienced institutionalized forms of oppression, including racism and poverty, social workers can build relationships with African Americans by encouraging trust and creating openness for the client to express their fears. It's important to note that African Americans find great value in family, community, and self-determination, which is a key area of focus for social workers. When working with Asian Americans, it's important to understand any immigration history or experiences, including family structure and their beliefs about Western psychotherapy. Language barriers, stigma, and internalized pressure to resolve life problems are common challenges of working with this population. It's also necessary that a trusting therapeutic relationship is developed quickly so that clients feel confident that social workers are true experts and able to offer clinical guidance. In crisis situations with diverse clients, attention should be given to pertinent issues such as inequality, faith, and social justice. It should be noted that crisis theory may not be appropriate for clients with disabilities, as it's sometimes easy for social workers to overstep their role and make decisions for the client. Crisis theory adheres to Western norms that are unfamiliar to the majority of the world, yet still provides several strategies for being sensitive to diverse needs and supporting clients to regain balance in both emotional and physical well being. Thank you.